Welcome, everyone. My name is Liz Yates Horton. I am a physical therapist who specializes in working with individuals with Parkinson's disease. I own my own practice, Engage, here in Syracuse. And I am just so looking forward to this 4-week series so we can be helping you stay safer at home and decrease your risk for falls.
And I'm Lindsay Kratzer, the owner and founder of Reflections Management and Care. We provide care management services throughout all of Onondaga County and surrounding counties, and we help folks through the process through life with a lot of different aspects. And I'm here with Liz to talk about the prevention of falls and the resources that are available out there for everyone.
Good, I need that.
That's why we're here.
Mm-hmm. Okay.
This is our first time here.
Well, welcome.
Yes.
All right, I am going to share my screen. Okay. All right, so, throughout our talk, we're going to be talking about falls, why do people have falls, and then what we can be doing to help prevent falls. So some safety modifications at home, different devices. We'll even talk about footwear and exercise, of course. And if anyone has any questions, feel free to stop us at any time. So falls, it can happen to anyone. About 1/3 of adults over the age of 65 have a fall each year. And 87% of all fractures in adults are due to falls.
Well, this is depressing.
Many falls don't result in an injury, which is why my definition of a fall is anytime you end up on a lower surface and you didn't mean to. I consider that a fall. That could be you land in a chair and you didn't mean to be there. You land in your bed and you didn't mean to be there. Because this is so important information for us to know, because there are things that we can be doing to help prevent falls. And then 47% of individuals who have a fall can't get up from the floor without assistance. So for those of you who do big class with me, Wednesdays, I love getting down onto the floor. A big reason why is so that we were practicing getting down to the floor and getting up, because it is an important skill that I think if you don't use it, you lose it.
Exactly.
Okay.
So specifically for Parkinson's, there was a study that looked at 22 different studies, and they found that 60% of individuals with Parkinson's had at least one fall, and 39% of the group had repeated falls. And that within a year, that ranged from having 4 falls a year all the way up to about 67 falls a year. So that is one of our big things that we want to be working on, is helping prevent falls. So some things that play a role in falls is actually having a history of falls. So if you have one fall, you're more likely to have another fall. The increased time that you've had Parkinson's, and increased issues with movement, and that can be slowness of movement. It can be extra movement. Treatment with dopamine agonists has been associated. Changes in thinking, having a fear of falling. So this is something that I often will go over with people, is how confident they feel about their balance and how they think their risk for falls is. Freezing of gait or walking, and just reduced physical activity. So we want to keep you moving and grooving. And another study looked at reasons for falls, and they broke down the reasons into two categories: intrinsic, which was factors that are related to a patient or person's health conditions, and extrinsic, meaning environmental factors like home setup, throw rugs, things like that. And they found that that 70% of individuals with Parkinson's falls were related to intrinsic rather than extrinsic, meaning that it had more to do with things that were happening inside your body versus how your home was set up. And the biggest thing that they found is taking a medication group called benzodiazepines really increased the risk for falls. And I just included some medications that are in that group. And we bring that up because it's really important to understand your medications and how that can impact how you're moving. And always a good conversation to have with your providers, especially if you see one of these medications on your medication list. So this sounds pretty serious. I know we started off pretty heavy, but the great part about this is, can you do anything about it? The answer is yes. So these are really great questions to ask yourself. Have you had a fall, or are you worried about falling? Have you noticed any changes in your balance? And I typically use a window of 3 to 6 months, thinking about how you were moving in the fall compared to how you're moving now. Or I'll even think about it in terms of holidays. Have you noticed a change in your memory or thinking? Are there any specific activities or situations that you're finding challenging? And this could be related to your balance. It could be related to freezing. You may be noticing that you are freezing or having smaller movements in specific areas. And that's really great to note. Have you done physical, occupational, or speech therapy recently? So I'm a big proponent of the dentist model for therapy in individuals with Parkinson's, that you are coming to do therapy, doing a checkup with us and making sure that there's nothing that we need to fine tune. And then you go off, you live your life, and then you come back to see us in 6 months. So we make sure that we're staying on top of everything. And then what is your current exercise program? And could it be better? Are we really doing focused exercises that we know are beneficial for individuals with Parkinson's? So what are the first steps? So getting tested, and that's for hearing, for vision, for foot care and sensation, and then for bone density and bone health. So those are all great things to be talking to your providers about and getting regular assessments. Going back to that list of questions that you were asking yourself. So note things that you're finding challenging, like write them down, and then, come and see a physical therapist to really problem solve. Home modifications is another great alternative. So working on making your home safer. And we're going to go through some specific examples on how you can do that. And then begin or improve your exercise program so that it's really tailored to you and your specific needs. So it's so important to keep track, if you are having falls, what is happening at that time. Is it a certain time of day? Is it related to maybe your medications? Oftentimes falls can either happen during an off time or an on time, maybe if you have extra movement. Are you dealing with lightheadedness? So maybe changes in blood pressure when you are changing positions. Do you have falls when you're feeling rushed or when you're distracted trying to do two things at once? Are there certain areas, maybe in your home, that you're noticing that you're having difficulty with your balance? Or maybe specific situations like getting in and out of the car. So all of that information is so helpful because then things can be really tailored to help you keep your balance and prevent a fall. So talking about home modification. So some basic things that you can do are taking note of your whole home and looking to see if there are obstacles in your common pathways. And this can be both inside and outside your home. So looking at common pathways, say from your bedroom to the bathroom or your kitchen to the living room. Is it a pretty straight, forward path, or do you have to maneuver around things? And the same thing for when you're coming out of your house to say get to your car. Is it a pretty straightforward path, or are you having to maneuver around things? Because that is a good starting place. Making sure that your staircases have handrails and grab bars in the bathroom. Making sure that areas in your home are well lit. Storing clothing and dishes and food and pretty much anything you need in fairly easy to reach places.
I want to add to that, Liz, as a care manager, when I go into homes, usually storing clothing, dishes, food, and necessities is the last to be moved. It's something that's so simple and can most definitely, moving the dishes from an upper cabinet, down to a lower cabinet, and placement with food in the fridge, if you have a freezer or, however your refrigerator freezer combo is. Sometimes those small things that we tend to forget about make a huge difference.
Yeah, definitely. Definitely. And that's something always to, just keep in mind, and where are the common areas that you are reaching, to get your common belongings. Another suggestion is using paint or tape with a bright color on door sills or thresholds to help avoid tripping. And then making sure that you have good footwear. So, and we'll talk more about that. So I was going to have us pause here and see if anyone has any questions so far.
I do, yeah. I was wondering about if there's a podiatrist you recommend for foot care. Is there anybody who specializes in people with Parkinson's or anything like that that you're aware of?
That is an excellent question. Lindsay, do you know of anyone?
I know that there is right off of Morgan Road, a podiatrist in Liverpool that comes highly recommended, Dr. D'Amico.
Okay.
Very great professional and focuses on all aspects, all diseases, but most definitely he has come most recommended throughout my career.
Spell that name, please.
It's
Could you spell
Dr.
that name, please?
Yep, it's capital D apostrophe A MICO.
Beautiful. Thank you very much. Appreciate that.
You're
Is there
welcome.
a difference between a podiatrist and a foot surgeon?
So
I don't know.
the foot surgeon, specializes in the feet, but a lot of times they distinguish, some do both. Some might do surgery as well, but some will just focus on clipping the nails, the nail health, where a referral might go to like a foot surgeon. The foot, again, there's different aspects within the foot that they might be looking at as a surgeon.
Yes, for example, I may need orthotics for my shoes for pronation issues.
Mhm.
And I didn't know if a podiatrist would be a better place or orthopedics doctor that specializes in feet would be a better option?
That's a really good question. And, you know, I would, most of referrals come from, with clients of mine from podiatrists. But I have seen them come from orthopedic, especially if there's other parts of the body, knees,
Mhm.
hips, things like that, that you're, you know, focusing on or might have trouble with.
Okay. Does this Dr. Amico also do orthotics?
He has, yes, yep. He'll make
Okay.
a recommendation, you know, to go someplace, to be specifically fitted for shoes, or orthotics. But yes, he will make those recommendations.
Thank you.
You're welcome.
One other question, Liz, for you. If you have trouble getting on the floor and getting back up, does that have any relationship with falls?
So not that I am aware of that there's a direct relationship between having difficulty doing that,
Mhm.
but where it does play a role is if you do have a fall, it makes it more challenging for you to be able to get up. And so that's one reason why in big class, we practice it. And then, you know, when I see someone for one-on-one therapy, that's always something that we're taking a look at and problem solving. How can we make that easier to do?
Okay.
Because my goal is if you do have a fall, that you are able to get up off the floor by yourself and you have that independence.
I know Patrick teaches us in the class on the gym, but I just didn't know if that had any relationship to preventing falls or helping with a fall.
Well, I think that the more you are able to move and keep your balance, you know, the
Mhm.
better your balance is.
Okay, thank you.
Yeah.
Liz,
Mhm.
I've had falls, and I have no idea what caused them, why I don't feel dizzy, my blood pressure is perfect. Is it the Parkinson's that would do this to me? Just do this sporadic, undefined or unplaced falls where I just all of a sudden I fall over. And I'm not doing anything. I'm not talking. I'm in the kitchen.
Mhm.
I don't know how I can be better if I don't know what's causing.
Yeah, I can understand how frustrating that is. And that's where, you know, really going into those questions, those guided questions about what exactly is happening when you're losing your balance. And so, Kathy, we'll use your example, you know, specifically in the kitchen. You know, diving into it about lighting. So sometimes lighting can play a role in increasing your risk for falls, or time of day, which can be related to your medications, either at an on time or an off time of your medications. Or is it happening with maybe a specific activity that you're in the kitchen and let's say you're at the sink and you notice that you have falls when you have to turn to get to the refrigerator. Or maybe it's that you are leaving the kitchen and are going into a different room that may have different flooring, which can be a trigger for freezing.
Mm-hmm. Well, I think I sometimes it's late at night, well, up late, and that might be, but sometimes it's just no time related.
I know how frustrating this can be. So a lot of times what I'll have individuals do is actually use like a voice, if you have a smartphone, using like a voice text, or just jotting down some notes, because that's all helpful information, because you may not see a pattern. But if you bring that information to, say, a session with your physical therapist,
Okay,
you know, we can sit down and take a look at it and say, like, gosh, like, out of, you know, you had, let's say, 5 falls in the last 2 weeks, like, let's take a look to see, and maybe looking at that information, we're able to pull out like a pattern that you may not have noticed because
Right.
you're living your life.
yeah, right.
Yeah. Yeah, but I definitely can understand how frustrating that is, feeling like you're losing your balance and it's hard to pinpoint, you know, a specific event or trigger.
Yeah, I did notice that I seem to be falling less now that I'm exercising more. You know,
Yay! Yay, Kathy. I love that.
Yeah.
I love
Thank you,
that.
Liz.
Yeah, moving your body really helps you, you know, stay mobile.
Yeah, and I catch myself a lot. You know, I would fall normally more if I wasn't exercising and practicing not falling.
Mm-hmm.
Exactly.
And that's where that having a specific exercise program that's really tailored to your needs is so important. Because everyone, you know, has specific reasons that they may lose their balance or specific things that that they need to focus on. And that's why having, you know, a really tailored exercise program can be really beneficial.
Kathy,
So how would you go about doing that?
What, so I'm going to put in another plug for coming to see me for physical therapy or occupational therapy, or if you're working on speech therapy, because all of us have a lot of tools and tricks to help get you a good, well-rounded program. And so a lot of times what we'll do is come up with some, you know, a couple exercises that are really targeted to what you need to work on. And then we have you, you know, connected to boxing with Empower, or you're coming to my big class, or you're doing, you know, voice exercises. So that way you're getting that well-rounded exercise experience along with some really targeted exercises that are going to help you.
And I just with Kathy, Kathy, it's great that you're catching yourself. You know, it's good to notice why and how are you catching yourself. Is it a feeling, a pain? Do you get dizzy? Those types of things. It's really important to recognize. You know, when you catch yourself. You know, how did you prevent that from happening?
Well, I think it happens because I'm prepared, not kind of. I mean, I'm not prepared to fall, but many times I do catch myself. I'm starting to fall, and I catch myself because I practiced it.
Yeah, right, and that's very helpful too. That I mean, again, we're stressing all of that, but you know, sometimes people get feelings like, ooh, you know, I turn my head this way or this far. You get dizzy and you know you fall, but that's good.
But sometimes I move too fast.
Yeah.
I'm in too much of a hurry. Gotta stop that.
Does anyone else have any other questions?
Not a question, Liz, but a comment.
Yeah.
This Dr. D'Amico, I don't know if it's the same one, but Ryan D'Amico is over in by the Kenny Drugs in Manlia Center Road. Ryan D'Amico, and I went to him, and he does orthotics. I don't know if he specializes in Parkinson's per se, but he does do orthotics with a, you stand on a thing and it shows you where you need, and they fit them for you. It's very nice, very good practice.
Thank you for that. I believe, if I'm not mistaken, that's actually Ryan is the son.
Okay. Yeah, I didn't know.
Yeah.
And for everybody, I did put the information for Dr. D'Amico in Liverpool in the chat. if you wanted the information.
Any other questions?
Well, going back to the podiatrist, the wife and I have been seeing Dr. Brian Popovicki in Liverpool. And we've been seeing him for years. And he is so attentive to taking care of everything. He's done operations on my wife's foot. my son's foot. And we've also had, he takes care of, he made inserts for the wife's shoes. He recommends certain shoes. And he also, if you bring, we brought in like 10 pair of her shoes, and he went through them all and showed us which ones were good and which ones are bad and why. So he's excellent at dealing with the patients and handling that.
That's very helpful. Thank you.
Anyone else have any questions?
I have one. I'm 2 years into this, and I find that I sometimes when I go to take a step, my heel feels like Jello, and it slides. And I wonder, is it the Parkinson's, or I'm not usually on wet ground when it happens. It's like in my garage, in my concrete, and it's very disturbing. But I didn't know if that's part of the Parkinson's or if it's something else.
Mm-hmm. So I think that's really a great insight that you have been focused in on that. You know exactly where it's happening. That's where like coming and doing a balance assessment can be really helpful. So in physical therapy, when I meet someone, and especially if we're focused on balance, we look at quite a few different areas of balance. So we look at how does your balance react when you anticipate that you're going to lose your balance, or that you're going to anticipate that you have to move around an object. We take a look at what happens to your balance when you don't anticipate, you have to react. And it can be a change in surface, or needing to take a step to catch yourself, and then taking a look at your balance when you're doing different things with walking. And balance incorporates so many different senses. And so there are quite a few different reasons why you could be experiencing that. And so it's really fine tuning and getting down to the reason why that's happening. Any other questions? These are really great questions. I hope you all keep them coming.
One other thing I'd like to comment on, that you were talking about things to do around the house. Of course, having railings on all of the stairways. We've been in this house over 55 years. So we have a 90-degree stairway to go upstairs. And I have railings on both sides of the stairs all the way up. So going up and down the stairs makes it so much easier, because you can actually have the grip to hold on. But I guess what we were really kind of hoping for today, and that you've covered a lot of stuff, is about falls is one thing, and how to avoid that. And we have our grab bars where we need them. I even made a step stool for my wife to get out of bed because she couldn't reach the bed, and made one that kind of goes underneath there. And then I have another grab bar on the sidewall of the bedroom so she can pull herself up, and so things work out. And a lot of this stuff recovering is things we've already done, but they're so important that they make a world of difference.
Definitely, definitely. And I'm going to have you stay tuned because next week we're going to go more in depth into modifications and suggestions for, you know, different rooms in your house. So we'll go room by room and talk about some things that you can be focused on at home. So come back next week. That's our plug for this being a 4-week series.
Liz,
Yeah.
the smart footwear, other than sneakers, what is there?
So my feeling about it is if you can have a shoe that is well fitting, that has a back to it,
Mhm.
that your foot doesn't have to work really hard to keep your shoe on.
Mhm. Okay, I agree.
Yeah. So, and we have a couple of examples when we get there. But like thinking about different footwear, like flip-flops,
Never.
much as flip-flops are great, they're really hard for, you know, our toes have to work really hard to keep our shoes on. And so when you're already dealing with balance issues, we don't need your feet working any harder.
Right.
You know, the other big thing is slippers that your feet can just slide into that don't have a back. Because again, your foot has to work a little bit harder to keep your slipper on.
Mhm.
Yeah, my dad needs shoes without heels in them, so he can slip them on, because otherwise it's just too hard and time consuming to get the shoe on.
Mm-hmm.
And sometimes I've seen where I'd be moving him in his wheelchair and the shoe will just fall off. But I don't know what other option there could be.
They're Kizik's.
Yes, that's it.
Yeah.
Yeah, that was going to be the brand that I actually we have a picture of. Is there is a slip-on sneaker and shoe that it was made specifically for individuals with Parkinson's.
That's called what?
Um,
What was the question? I'm sorry.
And what is that called?
Kizik, Kizik. Kizik.
ZIK.
Mhm, mhm.
Thanks.
You're welcome.
and I know that Nike also, I think it was last year, came up with an adaptive sneaker that was easier to slide in and out of too. But I've worked with several people who have the Kizik sneakers and really like them.
I have a pair of Kiviks, and they're very good. You can put them on, you don't have to bend down to put them on. Slide them on your feet. The back collapses,
Oh,
and it pops back up again.
Mm-hmm.
Shoehorn back in business.
yeah, I got a long one.
You don't need a shoehorn. That's a good thing.
And we also use the elastic shoelaces, so you don't have to tie them at all. They release and grab with a little button. Those are much nicer for me anyways. It's a lot easier. A shoehorn, yes, have long and short, and you got to have the long shoehorn. My body's not flexible, so I have to dig up some aids to help me with some of this stuff.
And I think that that's a really great point about having tools to, you know, keep you independent. That is a wonderful thing that occupational therapy really focuses on, is coming up with tips and tricks to keep you independent and using tools.
Patrick also mentioned Ziba footwear. So we did put that information in the chat if you are looking for the names.
Thank you.
Any other questions? These are really great questions.
Okay, I have not gotten to the point where Dad is gonna get over to Engage yet. I'm not sure how we would get transportation and stuff, but I've talked to Dina briefly. And so that's kind of coming up on my list of stuff to do. But right now, when he falls more than he tells me. And he recently, I was there when he told his doctor that he falls about every other day or so.
Oh, God.
And it happens when he's trying to go it alone, and he does not literally have railings on every inch of his house, because that's about what he would need. And so when he's like pushing his wheelchair, but when he tips back, he just sometimes pulls the wheelchair down onto the floor with him. And really kind of what he needs is something like an infant would use when learning to walk, where they're suspended down with a bungee cord from a bar or something, and they're able to move around, but they cannot fall. And I don't know if there's anything like that for adults, but I just feel like he just needs to be suspended from the ceiling at all times.
That's a tough one.
Yeah, so there's definitely some strategies that we can play around with in terms of the devices individuals are using to help them be more stable. It can be using if someone's using a walker, adding some weight to a walker so it slows you down, or if someone's dealing with freezing, using a light that travels with you, so it gives you a cue to increase your step length, so your steps aren't so small. And so a lot of that is taking a look at how someone's moving and hearing how they may be losing their balance at home, and working on some modifications to what they're already using. Because it sounds like, Bob, your dad it sounds like he's falling backwards. So,
yeah.
So, just thinking, probably we would work on strategies to get him to shift forwards.
The training that you would do it, you were saying you would coach them on something, then they come back the next week and tell you how they're doing. Is that kind of how that therapy works?
Yeah, we do a lot of problem solving. So I always joke that physical therapy here at Engage is very different than most other physical therapies. We do a lot of problem solving. Exercises are very dynamic. I'm exercising with you. I get a workout all day. And a lot of what we do is really is getting down to like the nitty gritty. Where are you having the biggest issue? And then what tools or tricks can we pull in to see if we can make something easier or help you be more independent. Any other questions? These are really great questions. If we are at a good pause break, I think we'll do our movement break, if that sounds good for everyone.
Sure.
So I'm gonna stop sharing. Yay, okay. All right, and then I'm just gonna spotlight my video. Okay, and so for those of you who do balance class, a lot of what we're going to do today is our warm up and balance class. So if you'd like, I'm going to have you all get standing up.
Let's try.
Today we're going to start with the basics of really getting grounded through our feet, So a lot of times when individuals have balance issues, our brain and our feet are not talking. You're on opposite pages. And so this is very often where I start is in standing, having us just check in with where our weight is in our feet. And that can be a question you ask yourself. Am I back on my heels? Am I towards my toes? Am I more on my right leg? Am I more on my left leg? Because not many of us stand perfectly symmetrical in both feet, in the middle part of our feet. And if you come to big class, I am often talking about our power stance. And so often in Parkinson's, when you're standing, it feels really normal to have your feet pretty close together. And so getting into a power stance where your feet are hip distance apart or maybe even a little bit wider. So as we're standing, I'm going to have you check in with your feet. Are you right in the center now that we've checked in? And so from here, we're going to work on doing some weight shifting. So I'm going to have you come over to one leg and then find center. And now we're going to shift over to the other side and find center. So we'll do that a couple times. So shift and find center.
Middle.
Shift.
That's it.
Find center. We'll do it one more time to each side. Shift and find center. Shift and find center. Okay. So we did side to side. Now we're going to work on forward and back, which oftentimes is more challenging to move through that range of motion. So we're going to weight shift towards our toe. When you're doing this, I don't want you to come all the way up onto your toes. You're just weight shifting just so your heel is starting to come up. And then we find center. And we're going to go back. I want, if you have any balance issues, make sure you have a chair to hold on to if you need it. So we're going to weight shift back a little bit just so our toes are starting to lift up. And then come back to center. So we're going to shift forward. Find center.
Back down.
Shift back.
Toes up.
Find center. Forward.
Heels up.
And center. Back.
Toes up.
And center. You may find that there's one direction that feels a little easier. Maybe it's easier to come forward, and going back feels like, oh, I'm going to fall right over. That's really helpful information. So from here, let's put those movements together. So we're going to do some weight shifting through a circle. So we're going to come forward. We're going to shift to the side. We're going to come back towards our heels. We're going to shift to the side. We're going to come forward. So I want you to imagine you're drawing a circle as you're weight shifting. Let's do that a couple times. As you're doing this, checking in with your posture. So sometimes when we're moving for our feet, we get really hunched down. Making sure you're still staying in your power stance.
That's it.
Weight shifting through our feet.
Back towards me.
And now let's switch directions. So let's go counterclockwise. If you were going clockwise. So whatever the opposite is.
When she says find center, that means go back to the middle.
As you're doing this, check how your circle is. Does it feel pretty even? Or do you feel like maybe it's an oval?
Go your way.
Or a lopsided circle? That's helpful information too, because maybe there's a side that's a little bit harder for you to weight shift to.
Now go heels down.
A sticky foot.
Very far.
Walking, sometimes it's harder to weight shift on that side. That's all really helpful information. Okay, so then let's come back to center, and I'm going to have you check in with your feet again.
Okay.
Were you able to come back to center, and are you pretty even between your right and your left foot? Are you pretty even between the front and the back? Okay. All right. So from here, we're gonna do 2 more exercises. I'm gonna have us work on coming up to our toes. So thinking about weight shifting a little bit bigger, and then coming back down with control. So when you're coming down, I want you to imagine there's an egg underneath your heels. You don't want to have scrambled eggs. So we're going to come up towards our toes like a ballerina, and then come down slowly with control. If you need a chair or a counter for balance, make sure you have that. So lifting up and then coming down. So we're just taking that weight shift and making it a little bit more dynamic.
Down slow.
If you're feeling this is a piece of cake, I got it. So then you can layer on. You can add in an arm movement. So as you're lifting up, lift your arms up. And then come down, float your arms down. Lift up, arms up.
On your toes.
Down,
Down.
arms down. Lift
On
up,
your toes.
arms up,
Down.
down, arms down. Let's do 3 more. Lift, arms up, down, arms down. 2 more.
On your toes.
Lift, arms up, down, arms down. 1 more. Lift, arms up,
On your
down,
toes. Back down.
arms down.
That's good.
All right, 1 more exercise to go. I think standing on one leg is such a great test of our balance, a quick and dirty test that you can be checking in every day if you want to. So often we need to get into standing on one leg, whether it's to put on our shoes or put on our pants or get our socks on. So if you need a chair for balance, please make sure you have one. So let's work on lifting up. Start with your right leg, and I'm going to have us lift, and let's see how long you can hold it for. But if you need a chair for balance, you need to hold on to something, please make sure you have something.
What's everyone doing?
Good so far.
Good so far, love it.
All
We'll do
right.
5 more seconds on this side. All right, let's put our foot down. Hey, let's try your left leg now. So we're lifting up.
I do it without holding this stuff.
How's everyone doing?
Trying.
Okay, great. All right, let's put our foot down. Okay, so great job, everyone.
Okay, let me pull this up.
Does anyone have any questions from those exercises? No, we're gonna keep it easy, okay. Yeah, so standing on one leg is a quick check-in, I think, that you can fit in throughout your day. Like if you're brushing your teeth in the morning, you know, just check in quick with your balance, see how it's going. And what we worked on today, where you're feeling your feet and working on weight shifting in different directions, is a really great exercise, because so often with balance issues, our brain and our feet are just not on the same page. So wonderful to get them chatting together.
I have a question.
Yes.
I was wondering, I had no problem standing on 2 feet and leaning and swaying and all that. 1 foot I could hardly stand on.
Yeah.
Is there any way to get around that or improve it?
Practicing.
Just practicing. Okay.
So practicing it. And then, so working on getting your base of support smaller. So when we're working on weight shifting, your feet are apart. So how you can progress that is bringing them closer to together, and then even bringing them into like a staggered stance.
Yeah.
And I would just make sure that you have something close by to catch your balance if you're feeling a little wobbly.
Okay, good.
Yeah, but standing on one leg, doing it by a kitchen sink is a great, check-in for your balance, even if it's just for a second or two.
Small letters,
Okay.
one word.
I was discouraged. I couldn't stand there very more than a couple of seconds.
Well, so I think that's a good baseline. So today is a couple seconds, and see if you keep working on it over the next 4 weeks while you're coming, to chat with us, see where we're at in a month.
Okay, thanks.
Yeah.
Question.
Mm-hmm.
What would you recommend for like total exercise time during a 24-hour period?
So that just depends on the type of exercise. So I think 30 minutes to 60 minutes of exercise is really great every day.
Okay.
Okay. And there's different types of exercise. So there is aerobic exercise where we're working on getting your heart rate up. There is balance exercise, like what we just did today. There's exercises to work on strengthening. And then there's exercises to work on flexibility.
That's funny. We've been using a set of CDs from the Elder Gym that we purchased probably 10 years ago.
Mhm.
And they cover exactly the 4 things you're just talking about. And they're half-hour exercising programs. But some of them are a little difficult now with the feet and everything, but that's an excellent program that they run.
One of the biggest things that we know about Parkinson's is the benefits of that aerobic exercise, and especially trying to get your heart rate up. So that if someone's able to do that, that is usually a key part to our exercise plan.
I see.
And
That's
that can
good to
be
know.
and that can be monitoring your heart rate. It can be monitoring how hard you feel like you're working, because there is a good correlation between that. And working at a moderate to high intensity, as long as you're medically able to, is really beneficial for Parkinson's. And actually, in the last week, I go over some more specific recommendations on how to build that program.
Okay.
Liz,
Yes.
would you say you have exercises that I might do to improve my bone density?
So coming to big class, you are doing a lot of exercises that can help improve your bone density or maintain your bone density. So we know that weight bearing activities, activities that have some impact. So like yesterday when we were jumping the line, great for bone density.
Okay. Because I know people with Parkinson's have a lower vitamin D count, and that's what's in calcium supplements. And those things can be hard on the stomach.
Definitely.
Yes.
Definitely. And actually, we, I believe it was August last year, did a whole blog series on bone health and Parkinson's. So if you come to our website, I believe it was in August, it was a 4-week series on bone health.
Must have been out with a broken foot. Yeah, because I would have for sure gone to that.
Oh, it was a blog post, Ellen.
Oh, okay.
Yeah, my husband wrote the blog posts. That's why I remember.
I remember.
Yeah, it was all summer. I put it out August, so that way he had all summer to write them.
You have a website,
We do. I can put that in the chat.
please?
Oh, good.
Does your husband write all those blog posts? I thought you got them from some other like place or something.
Oh, you were looking at one of the writers of all of those blog posts.
Yeah, I was going down through them. There was a lot of very relevant topics in there.
Yeah, so we write a new blog post every week.
Wow. I thought you must have like just got those from some other like source of some kind.
Oh no, we write them every week, and if there's any new research article that comes out, we share that with a summary, so that way you all are staying informed.
Well, very nice.
Yeah, thank you.